So I want to invite Irit Livne. She is the head of the health education and health promotion in the Ministry of Health. She did her master's.
Ministry of Education.
Yes, education, exactly that thing. Almost in the Ministry of Health. So we work so much together, so she's almost working with us. She did her master's degree in MPH, and for the last 22 years, she's the head of the health education in the Ministry of Health, and have done some revolutionary nutrition system of lunch program, and work with us hand with hand to change the nutrition in the schools. And I want to invite her to give a lectures what's happening in the nutrition education at schools these days.
Okay, I will be more realistic and not dreaming, I'm sorry. Maybe I will be the bad guy that will tell what can be done in Israel, but not dreaming, but realistic. First of all, we're working together. That's one of the things that although we don't agree, but we are working and thinking together with all, first of all, with the Ministry of Health, and then with all those who are interested to change. But although you showed, Dorit, examples from the world, we are not going, I think, I don't say if I am sad or not, to build in the curriculum something that will go through from kindergarten until the end of the high school. But that's what I'm going to say. Okay. We are thinking that there is no health education lesson and not health education teacher. We are thinking that in Israel, in our conditions and budget and so on, every teacher and headmaster and so on have to be a health educator. It can't be in these days a lesson or one of the staff that will take care about health education. So the epidemiology is bad, we know it, and you know better than me. Overweight, obese, chronic disease. So that's the new idea. We decided with the general manager of the Ministry of Health and to form the schools and kindergarten as health promoting settings. All schools, all kindergarten until 2020. And I think this is the main issue that we are going to deal from now on. This is the Ministry of Education, the big giant, and and all of us are the little, so we have to move this giant. Nutrition has to be changed, we know it. And active routine has to be the only option. And we have a very big problem, and Ricky afterwards will show you how bad we are in this. And it means healthy lifestyle as a routine at school and after school, in the kindergarten and after it. A change of food that is given or being sold. We are now changing from next year, from the 1st of September, we are making a very big change with the Ministry of Health and in the Ministry of Education, in every school, in every canteen, with the parents. And Dorit, you didn't spoke enough about educating parents and the population, because we can't do it alone at school. It won't be changed. No, it's not good. It's not in Israel. It won't work. We have okay. So, no sweet beverage from the 1st of September next year. No sweet or fat food at schools and in kindergarten. By law, I'm sorry, it has to be by law. But from 10 years ago, we thought that we can do it without, but we have to do it by law, and that's what we are standing now. Protocols. We have in Israel, Chozer Mankal, who knows, should address education to all members of school environment and community about what is the healthy choice that recommended and what are the new regulations from now and on. I've been more than 10 years in England, and the regulation was so clear to all that all of them are working again. In Israel it doesn't work, we know it. So the regulations are now being published. The Knesset will deal with this, and we hope to change. No more sweet breaks. הפסקה מתוקה. It's a habit, a bad habit in Israel. Children can buy in 5 shekels a lot of sweets. It will stop. Healthier birthdays, parties in the kindergarten, parties, festival, holidays. Everything has to be changed to a healthier food and drinks. A physical activity. We have 2 hours a week obligatory physical activities lesson. It doesn't give us and the children anything. We want them to change and to have a lot of free physical education during school time, every break, and to have fun from it, and then not more of the same. Staff and the parents. A very big issue is to involve the parents, to bring them to school or to the initiatives that school is dealing with. It's a problem all over the world, especially in Israel. So they can take care together, parents and staff. It's the only subject that in Israel the staff can have the parents in school, because in mathematics and the other subject they are out. So to all the related activities of school, provide non-discriminatory opportunities to all students to study in a health promoting settings in 2010. This is our goal. So what is our task? Ensure that every student receives safe, reliable, and effective manner and has access to his needs and all time during the school day and the school-related activities. We have non-formal education, a lot of non-formal education. It's included in it. It's not only from 8 to 1 o'clock. It's all around all the activities. All the tools and materials were adapted, and all kinds of population and available for all ideological and religious movement. We have not Jewish, non-Jewish, religious. It's a very big issue that we are dealing now, how to spread it out all over the educational system. And 25% of the educational system is Haredim now. So we have to deal in another way with them. This is and we are talking about materials, and this is our web. We have a lot of materials. Part of them we translated from English from the WHO that we were part to put it or to spread it all over the world. We have a lot of materials for teenagers also. This is the physical activity pyramid that we are speaking about. This was adapted to the Haredim, and you can see all the changes that we have to do and to bring. This is part of our materials that we have for school. Efshari Bari, I hope they spoke about it. So we are doing together, Ministry of Education, Ministry of Health, and Ministry of Sport, to interpret and integrate all the subjects into the Ministry of Education, into the system itself. We want them to have and to eat healthier food. What about the role model of the staff? So we want them to be like this, but we don't have time. But these are our clients. Thank you.
Thank you, Irit. A really challenging work she has. The only one who speaks about health in an education surrounding, which is not so easy. but she's doing a very tough work, and we work together in the Efshari Bari, which is a major program of the Ministry of Health, and the Ministry of Education, and the Ministry of Sport, and with the aim of reducing childhood obesity and better health for all.